Well, thank you so much for being here with us today.
Yeah, thanks for having me.
I'll let you introduce yourself. Can you give us your name, title, and background?
Okay. I'm Eric Thrailkill, the chairman of Project Healthcare at the Nashville Entrepreneur Center. I've been in Nashville close to 40 years. Started my career with Deloitte and then 3 different healthcare provider organizations, all as CIO, most recently AmSurg and Envision Healthcare.
Mm-hmm. Awesome. And tell me what you're doing with the entrepreneurship and Project Healthcare.
So Project Healthcare is in its 5th year, and I chair that particular program. We have 17 cohort companies in this class. It's a 12-month program. And then my role is how to really build the ecosystem of partners and mid-market tech companies as well, and then contribute to thought leadership of emerging issues, technologies, and challenges that remain in the industry.
Mm-hmm. And of course, that leads into you guys launched the Telehealth Academy this past year. Tell me why you launched it and what you guys have been doing with it.
Right. We got the idea from a company called the Disruption Lab that approached us, had done a series of webinars. And the thought was the industry really acted in a sort of a Herculean way to deploy telehealth and various technologies and digital at the onset of the pandemic. And while that had tremendous benefits for physicians and patients, it was done probably without the longer-term strategic viewpoint that a lot of organizations really need. It was also done in a very relaxed regulatory environment. So the Telehealth Academy is 18 plus months since the onset of the pandemic. Learnings of what occurred, of what went well, what the industry needs to continue to work on, and trying to address a little bit of the remaining uncertainty that exists with telehealth and virtual care.
Mm-hmm. And who all was involved in this?
So we had 3 different partners. So Project Healthcare, Nashville Entrepreneur Center, we took a lead position. The Disruption Lab, a local company in Nashville, focused on corporate innovation. And then Sage Growth Partners out of Baltimore, Maryland, experts in healthcare, market research, strategy, and marketing.
Mm-hmm. And who attended it?
Attendees are from a broad range of professions within the industry. Mm-hmm. So we have a lot of provider organizations, officers in telehealth and virtual care and clinical and operations positions as well, to really bring the entrepreneur into the discussion. We have over 70 CEOs and founders of startup companies, digital health companies, and virtual care companies.
Mm-hmm. And I know you're still, going through the academy, and you still have a couple sessions left. But I know that you've already had some key takeaways that you've learned through this entire experience of bringing everyone together, right?
That's correct. So it's an 8-week event. Every Tuesday, starting September 14th, it concludes November 2nd. 3 hours, which is a pretty heavy lift for people to attend these days. We make the sessions completely available on demand. We have over 360 registrants, registered attendees to the event. We publish weekly recaps and make the video and the presentation materials available to the attendees. And we do have some key takeaways at the halfway point and maybe some more recent learnings as well.
Mm-hmm. Yeah. So let's get into those takeaways because I think they're super interesting and really sum up everything that we've been talking about here on the podcast, which is just incredible. So the first one you have is telehealth has been a long time in the making, but made huge advances virtually overnight with the onset of COVID-19. I mean, we've definitely seen that. Tell me more about it.
Yeah, I think everybody remembers where they were at the 1st of March, and particularly on March 11th, 12th, 13th, and 14th, which were key milestone dates for the industry. We had 6 different health systems, including Vanderbilt University, HCA Healthcare, Atrium, the Mayo Clinic, Intermountain, and Mass General Brigham participate. All of them said they had telehealth and virtual care solutions in place prior to the pandemic, some 10 to 15 years prior to the pandemic. Mm-hmm. Utilization of those tools and technologies was measured in the single-digit percentage points, maybe 1 to 5 percentage points. Overnight, it went from about 85 to 90% in every one of those organizations. So that at the onset of the pandemic, tremendous implementation of solutions, making them available, relaxed regulatory framework, safe conditions for patients that did not have the disease at that point in time, and ensuring continuity of care existed for a country that was in the middle of or at the onset of a public health emergency.
Yeah, and I think what's interesting about this point is that, of course, this hefty utilization happened overnight, but establishing the framework has actually been a long time in the making. I mean, we've been talking about telehealth for, over a decade, but it really never took off. But these companies that initiated the technology, they had been working on it for a while, and those were probably the ones that were successful in deploying it, right?
That's right. And we used to, I would say, generally think of telehealth as a substitution for in-person care. And now what every organization is thinking about is it's really combined with and integrated with in-person care, meaning that an individual needs to have access to a provider, needs to have access to the person's electronic health record. And all other data about that individual and their lives in order to really assist with telehealth and virtual care capabilities. There were also some, various federal and state regulations, and particularly around payment parity. Does payment exist for a telehealth service as it does in an in-person service, which was not the case for a lot of services? In really ensuring that the incentives didn't exist, the financial incentives to make the investments in the solutions and really integrate those programs the way that they needed to be.
And they exist now in the emergency period, but what's going to happen when that emergency period is over?
I think that is a fantastic question. And if you have any insight on that one, we would love to have it.
We're trying.
We had a couple of policy experts, including Paul Keckley of the Keckley Report and Mei Kwong of the Center for Connected Health Policy, both talk about federal policy and state policy. State policy is really, really interesting because that's where all the licensing and credentialing of the providers occurs. States have different laws, as you know. I wish I would have paid attention a little bit more in my fourth grade civics class to really understand this federal versus state dynamic. But they control the licensing and the credentials of the providers that can provide services in that particular state, making it difficult historically for a provider in Tennessee to see a patient in Kentucky via virtual health and telehealth. All of those rules and regulations were relaxed during the pandemic, as well as federal government and commercial payers would now pay in parity with services that were delivered virtually.
Yeah. And you mentioned this earlier, that telehealth is not going to be a substitute for care. It's a supplement. And that gets to one of your other key takeaways, is that your future healthcare is probably a hybrid model. What does that mean?
Yes, definitely. And I think every one of our 31 faculty members has touched upon this, is that, as we really think forward into true value-based care and whole person care, we have to have the information, the tools, and the technology to really meet patients where they are. And in the U.S. healthcare for 50 plus years, it's been location-centric. A visit to a hospital, a visit to a doctor's office, or an urgent care center. And now the thinking is, rightfully so, that doesn't work for everybody all the time, 24/7. And if there are technologies available to provide whole person care, then they should be incorporated and integrated with in-person care. Better experience for patients and consumers, a better experience for a lot of providers.
Yeah, and I think it's interesting what that means across the sectors, because I know with behavioral health and mental health, they found that sometimes a phone call or a video chat can replace the in-person visit. Sometimes people feel more comfortable in that setting talking with, a counselor or therapist. But in others, like I think, home health or primary care, we see it that you're making just more connections with your patient than what you typically would. It's a continuation of that care, which I think is super interesting. Can you speak to how that's going to change care delivery models at all?
Yeah, it's again another good point and very interesting. In fact, we're seeing a shift in a lot of the technology being able to support hospital at home concepts. So one of our speakers estimated that about 30% of inpatient stays today could be performed in the home with the right access to a provider and the technology to support those monitoring and devices. The intersection of behavioral health and mental health has been a really interesting topic from a lot of the academy faculty, and ensuring that mental health becomes a part of medical care. And there's a lot of evidence to support the impact of an individual with whole person care, including mental and behavioral health, in reducing their costs, being more adherent or compliant with medications, and having lower medical cost over a period of time. Telehealth and virtual care will allow us to bring some of those concepts together.
Yeah, and you've mentioned the data portion, and I find it super interesting because I was going to the Y yesterday, and I started wearing my Apple Watch again, and I was setting up my health app, and I know that it tracks your fitness, it tracks your nutrition, for a woman, it tracks your period. I was like, that's weird.
Right.
But I could also integrate it with my EHR at Vanderbilt.
That's right.
And so I really, am super interested in this data portion where you said we get a more holistic view of the patient and their health day to day rather than, the one time they come into the doctor's office per year. Can you talk to me about how that's going to change how we care for patients?
Yeah, this is what I'm super excited about for the entire industry. The availability, the access of data, and frankly, the last decade of cloud compute and storage capabilities will enable healthcare organizations to have a much better view into a person's life, including their wearables, including remote, what the industry would call remote patient monitoring, or devices, blood pressure cuffs as an example, temperatures as an example, scales as an examples that can be located in the home, as well as a better understanding of that person and their social determinants, their income levels, their education levels, their needs for transportation, their support, family support, caregiver support, all brought together through data platforms that can provide, with artificial intelligence and machine learning, the capabilities to do proactive monitoring around health versus just seeing the person when he or she is sick.
Yeah, and that's the next takeaway, that telehealth is more than just a phone call with your doctor now. I mean, it's expansive. Tell me about all the technology you can use.
Yeah, we've had great discussion around something as simple as a phone call, which meets all the regulatory requirements in the public health emergency, to really sophisticated technology, both in an inpatient facility as well as within an outpatient setting and at the home. So again, giant amounts of literally hundreds of thousands of remote devices, various wearables, data from your EHR, a very favorable government and bipartisan support for open data and patients' access to his or her own data. And the ability to share that with your family or other providers is now legislated at the federal level. Making all of this data available with your consent to provide the tools and resources most convenient for you.
And with your consent, I think, stuck out to me, because we're going to have a huge conversation with consumers that might be skeptical of all this data collection, or, just don't trust, whatever to have that data. What kind of conversations do you see around that?
Yeah, I think another good point. We've had a lot of discussions around data privacy and security. But we have very modern technology and ways to tokenize data to create a longitudinal record without violating any of the providers, individual provider organizations, security and privacy frameworks that are, again, also federal and state legislated. So security and trust, I would say all of our faculty at one point in time, which numbers, 31 over the 8-week period, talked about trust, that this only will work if patients trust that their providers with access to this data and these technologies are actually contributing to healthier outcomes for the individual. Same on the provider side. This will work only if providers feel that they've got a trusted relationship with that individual patient.
Yeah, absolutely. And then the next key takeaway that you had is telehealth has the opportunity to bridge equity and access gaps in healthcare or make it worse.
Yes. We've had a lot of good conversation around what the pandemic has exposed, on grand scale to all of us that are watching. Very uneven access, very different health outcomes that we've observed for different communities based on location, based on income levels, based on race, et cetera. Telehealth can help bridge gaps of access and equity and fairness and open resources. It comes with, maybe some observations and some perils that it could also make this worse than it is today, widen the gaps of access and equity. So a lot of legislation at the federal level focused on how do we bring resources to rural communities, broadband networks, as an example. How do we create an environment, again, in a trusted environment where your culture or your health literacy, you can use the tools and trust those tools that are available to all of us today. And then how do we purposefully and intentionally, and I think this is the only way, address those issues in terms of strategy and investment to make sure that it doesn't create additional chasms in those two areas.
Yeah, for sure. Because when we think about telehealth, it's always been used in rural settings to sort of supplement the lack of specialty physicians or, just lack of physicians generally. But I know when I was talking to Meharry Medical College, who recently rolled out a telehealth program to monitor their patients that have chronic health conditions, one huge barrier that they faced was that digital divide, that some of their, patients just simply didn't have Wi-Fi or, the infrastructure that they needed to deploy wearables and telehealth into their homes, that they actually had to go out and provide hotspots and give them all of this technology to really be able to do it. And they said that that's something that we will have to scale in the future to make this equitable across the board.
Yeah, no question. And you've touched upon another concept as well, as I think all of us have observed that clinicians at every level are under tremendous stress as a result of the emergency and frankly with life as a person living through the emergency as we know it. Telehealth and virtual care has the opportunity to relieve a lot of the clinician burnout that's occurring today and ensure that access can be provided in a lot of rural communities where it's difficult to see a specialist or in the event of an inpatient emergency, sometimes several miles from nearest facility. But you're right, investments have to be made very intentional to ensure access and equity are at the forefront of these strategies moving forward.
And when we talk about, Medicare populations, Medicaid populations, even uninsured, the people that are traditionally the sickest in the country, telehealth allows us to look into those social determinants of health that are affecting their overall health. Can you talk to me about that?
Yeah, just a few maybe data points on this that I think are really, really interesting. So when Medicare started back in the 60s, about 10% of the population was 65 and older. By 2040, that number is going to be 22%. There still is about 10,000 people every day that turn 65 in this country that are eligible for Medicare. Medicaid rolls through 50 states have increased, obviously, during the pandemic, and there's an expectation that that trend will continue to occur as states expand Medicaid in their particular areas. Cost, as a result, are expected to continue to increase and outpace what we know is inflation. The $4 trillion industry that we know today is projected to be $6.8 trillion in 2028. So in just a few years. And a lot of the regulatory framework, a lot of the evidence that's required is how do we provide resources to those populations to ensure better health quality and superior safety and reduce the cost. And this is where a lot of the entrepreneurial community, a lot of the innovators, a lot of business model innovation is actually occurring, trying to tackle those really tough challenges with those populations. I would say on the employer side as well, maybe 160 million to 170 million of us, half of the country or more, are provided health insurance through employer-sponsored insurance. And we had a really good session from the business group on health, as well as a leading provider of on-site and near-site employer health solutions, Premise Health, locally in town, where the employers are looking at the availability and the tools and the technology, but somewhat with an eye toward let's make sure that this doesn't actually increase the cost of care for the employers that the employers are picking up today, and want to ensure that the industry really responds to solutions that are addressing both cost and quality.
Yeah. How do you do that?
It's in my own opinion, I think it's partnerships need to be made between those that are in the industry today, leading healthcare companies, many of which are based in Nashville, with technology, with innovation, and with investment capital to really address all of these with purpose and intent, all of these macro challenges within the industry. It will be difficult. It will be a long journey. Many believe we're at the very forefront of a decade of innovation. It will require both state and federal policy support to really be effective.
And your last takeaway, and this goes into that, is education is key for providers, for patients, I imagine for the government. Can you talk to me about that?
Yeah, a little bit of, we might all assume that telehealth is just maybe a FaceTime call over an iPad, which, by the way, qualified during the public health emergency as a qualified visit. And while that was a convenience to a lot of people, and perhaps and hopefully a convenience to the providers, it felt disconnected from other parts of their life and their electronic health data stored either through wearables or in clinical systems. Education now about what's possible, surrounded by a trust framework, will allow people to make better choices for themselves and allow and create the evidence for provider organizations to make the investments in innovation that they need to really provide whole person care 24 hours, 7 days a week. And that's what I'm hopeful that we can all continue to learn through events like the Academy and others, experts in the industry, as we move forward and take what the pandemic catalyzed for the industry into the next decade.
Yeah. And with the Telehealth Academy, you brought in so many players, businesses, entrepreneurs, innovators. So you really have this grand scope of what we as a Nashville healthcare community want to do with telehealth and how we're going to deploy it to patients and everything. I guess when you put it all together, what made this incredible era of innovation and deployment of telehealth possible?
I'd say it's a decade of convergence of a number of factors. Cloud compute storage capabilities from Amazon and Microsoft and Google just in the last decade has grown exponentially, where innovators today can build enterprise tech solutions overnight, sometimes with a credit card to get moving. favorable government influence, meaning, and most recently, the 21st Century Cures Act, which really freed up a lot of patient access to their own data, but also created an interoperability framework where information could be exchanged between entities. Total support, bipartisan support, and bridging administrations from President Obama to Trump to now Joe Biden made that possible. And then third is a giant amount of money is what a lot of people are referring it to, but just overwhelming investment by venture capital, private equity, and big retailers. We've seen an enormous influence of Walmart, of CVS, of Walgreens, perhaps of Dollar General, located here in Nashville, recognize that they've got literally thousands of stores and access points, many of which in rural or underserved communities, and the combination of technology and healthcare services could bridge some of these, again, macro gaps. So all converging together with the unfortunate occurrences of a pandemic that says we have to do this overnight, and now I've learned that this can be brought forward into a new era of healthcare delivery.
Yeah. Well, thank you so much for coming on and being here with us today. We really appreciate all of your insights.
Yeah, thank you. I've enjoyed it. Thank you.